जान जिम्मेदारी से बचाना।
थैंक यू श्री गोला बाबूराव। श्री गोला बाबूराव।
Vice Chairman sir, I thank you very much for permitting me to speak on the important piece of legislation which proposes to levy the cess on production of pan masala and money to so collected will be used to take care of public health and national security. Sir, the cause of the bill is laudable and hence I support this bill on behalf of my YSR party. Sir, there are two issues. One is to improve the public health and second one is banning of intoxicating substances. The first part of it is being addressed through the bill and second part of was addressed through Central Excise Bill passed by the just very House of 4th of this month. Sir, the second point I wish to make is about health care. Bill giving emphasis on health care and every state has to give the importance to public health. Public health can also be achieved if you have doctors. Doctors can be produced through medical colleges and when you have government medical colleges, we can provide health care to poor and downtrodden. Nowadays it is very much difficult to get a permission to start medical colleges in government sector. If you see I feel no one on earth will convert those government medical colleges into private medical colleges. I am saying this because doctors come out of the government medical colleges have mandatorily work in rural and remote areas to serve the poor people. In AP, there is a peculiar situation. National Medical Commission has given permission to start 10 medical colleges in government sector, but the present government is converting them into private colleges under PPP.
They just speak on the subject that will go on record.
PPP model. Sir,
I'm already questioning you. Speak on the subject.
This is a part of the bill, sir. If he had anything, after I speak, he can come and raise this issue. Sir, now this move is against the poor and downtrodden.
It's not
deprives them
it's
of
not discussing a state decisions and subject.
Bill is emphasizing.
Please.
And not only this, the move also deprives students who cannot afford to study the private medical colleges.
Golla Baburao, please speak on the subject, not on the state issues. That will only go on the record.
Different subject, sir. This
no,
is
not on the subject.
The subject.
अगर आप subject पे बोल रहे होते तो मैं interfere नहीं करूँगा.
The next point I wish to make is the bill says more you manufacture pan masala and similar goods, which is a great health hazard and one of the reasons for cancer and disease in the country and ruining the families, the higher the cess would be. If one looks at the clause 7.1 of the bill, it clearly says that health security is the national security. Cess shall be levied for the purpose of meeting the expenditure on national security and for public health. But I wish to know from Honorable Minister that she has not specified the activities of national security for which this cess is going to be used for. For that matter, she has not mentioned how the cess is used for a public health. I feel at least she could have been broad contours of how the proposed cess is going to be utilized. This is a very well thought out bill and meticulously drafted one. I am saying this because of so far government has major challenges with pan masala and manufacturers. It is because manufacturers basically unreporting their production and it is very easy to stuff large quantities into small packets. The Vice Chairman, sir, if you look at the clause 5 of the bill, it outlined 3 parameters for the cess computation. This relevant process in speed and capacity of the machine and weight of goods packed for pouch, tin or container, and the manufacturer is required to file a self-declaration stating these parameters which a proper officer will verify and calibrate in the next step. Through this, the government is aiming to close the loopholes or gaps, the strengthening oversight and discouraging evasion. So I welcome this. Next, sir, next point about the cess. Sir, in a written reply to the question in this last session, the Honorable Finance Minister informed that government has collected 19.4 lakh crores in the form of cess over the last 5 years, starting from financial 2021 and financial year 25-26. The government has budgeted cess collection rupees 4.18 lakh crore, 8.19 crore more than the financial 24-25. Revised estimates. So here, my point is, since cess and surcharges are not being shared with the states, in spite of the repeated requests by the states, I would like to seek the clarification from the Honorable Minister whether the proceeds of the health security, national security cess is going to be shared with the states, since health is a state subject and this is a primary responsibility of states to implement these schemes and programs relating to health. Sir, with these submissions, I support the bill. Thank you.
Thank you. Thank you, Golla Baburao ji.